Out there, beyond the developed world, there are some truly alternative diets.
It's green. No, don't.
Strange techniques for diagnosing illness.
That really is burning.
Brutal ways of healing. And very different ways of dealing with pain.
I mean, that is absolutely amazing, isn't it?
My name is Chris van Tulleken, and this is my brother, Xand. We're both doctors, and we're also identical twins. Trained in tropical medicine, we are ideally suited to go and experiment with life beyond the reach of paracetamol and Prozac. And to find what, if anything, our world can learn from an older way of doing things. This part of our journey is to Asia to find out how to conquer pain. From extraordinary ritual piercings to an ancient medical system that has no painkillers, we're going to meet people who can cope with agony inconceivable to a patient in the West. But to discover how they do it, we'll have to experiment on ourselves. My brother Xand and I have come to Kuala Lumpur, the capital of Malaysia. Every year, hundreds of thousands of people crowd the city streets for the Hindu festival of Thaipusam. For Hindu devotees, the festival is an opportunity to show their faith to the god Lord Murugan. But Xand and I have come for a very different reason. As doctors, we deal daily with people in pain. We've seen patients with identical, terrible injuries, one of whom will be sitting up in bed and talking, whilst the other will be screaming and vomiting with pain. And no one's quite sure why people react so differently. So we've come to Asia, where they have a different approach to pain, to see what we can learn. Here, in the name of religion, people willingly submit themselves to some excruciating-looking piercings.
It's just astonishing. I mean, that is absolutely amazing, isn't it? I mean, I think that, what's that? That boy must be about, maybe it's 12 at most. Swaying a little bit now. It's not bleeding. Didn't put up any fight.
What makes these piercings so extraordinary is that some devotees claim that if you follow a strict diet, observe celibacy, and pray to the god Lord Murugan, he will ensure you enter a trance. Then, when the hooks and skewers go in, you will not bleed, you will not scar, and you won't feel any pain. To see if this trance state really can prevent pain, we've devised an experiment. But it means we're going to have to experience the piercing for ourselves. The experiment had begun a week before the festival. Xand had left Britain and flown the 11,000 kilometres to Kuala Lumpur in Malaysia. There, under the guidance of a Hindu priest, he would follow the preparations required of a devotee. To understand the spiritual aspects of the festival, he received religious instruction and performed a puja, making offerings to the gods. For Xand, staying celibate, teetotal, and eating almost nothing but fruit wasn't much fun. But coming face to face with the large silver skewers that would be used for our piercings was even worse.
There's the one for the cheeks, and there's the one for the tongue. This doesn't seem like quite as enjoyable an investigation as it did when we first started, so we'll see.
While Xand continued his preparations in Malaysia, I carried on my life as normal in Britain.
Who's that? Looks like she's breaking her arm.
Working in a stressful job as a doctor in a London hospital and eating and drinking whatever I wanted. In theory, this meant that unlike Xand, I would not enter a blissful trance and the piercings would hurt. A lot. But medicine has a long tradition of self-experimentation, so bizarrely, I got on a plane. And now I'm here with Xand. and it's time to put the ideas into practice. If the theory is right, and Xand is prepared properly, he should have a very different response to me. He will enter a blissful trance and feel no pain as the skewers go in. I, however, will feel absolutely everything. And I'm starting to get nervous.
I think this looks abysmally painful. I think that if I had any fix in my back fruit, I'd want to stay jolly still, so yeah, more. And he's really sort of shaking it and almost making it worse. But maybe he's just agitated, not comfortable.
Getting changed into our ceremonial clothing, it becomes clear that Xand too is beginning to have some doubts.
I'm just nervous about the piercing, really. I think that's... I can't get out of my head, it's going to hurt.
This water is meant to cleanse and purify your body, but I'm worried it's coming straight from the filthy river behind us. I'm about to have metal skewers pushed through my face and tongue, and this shower feels like the way to get a terrible infection. The final stage of the experiment is about to begin. Xand's standing in front of me, but I can still just see a man writhing around as the priest prepares to force a skewer through his cheeks. If either of us is going to back out, it has to be now, because when the priest gives the signal, it will be our turn. Xand is going first. If Xand has done everything that the Hindu priests have said he should, he will enter a blissful trance and feel no pain. I can't tell if he's in pain, but I don't like the way he's bringing his hands up, as if to stop the priest from piercing his tongue. His eyes are glazing over, but it's impossible to tell if this is a deep trance or complete agony. All I can think about is that it's about to happen to me. The priest starts to rock me back and forth, and then tries to grab my tongue. When the skewer goes through my tongue, a burst of pain shoots through my whole face. I barely notice the one through my cheek. All there is the tearing agony in my tongue. We now join the main procession as it slowly winds its way 2 kilometers through the streets to the Batu Caves, a holy site where the skewers will finally be removed. I thought that the pain would subside, but to my horror, it just gets worse and worse. After 2 hours in the tropical heat, we're exhausted and dehydrated. We're helped to the top of the 272 steps that lead to the cave entrance. Xand is first to get his skewers taken out. Then it's me. As the first skewer comes out, it feels instantly better. But it isn't quite over. The relief is overwhelming. But I want to know how Xand's feeling.
I don't think I can speak. I can speak a bit. It's not as bad to speak as you think. It's not as bad as I thought, actually. I started dreading the speaking. It's painful. My tongue was abominable.
Yeah, the tongue was predictably the worst bit. If you draw a picture of the human body with the senses mapped out in terms of area, you'll have huge hands and a huge tongue, because your tongue's got loads of nerves. So unpredictably, the tongue was absolute agony. The cheek I didn't really notice.
It was an extraordinary experience. Despite Xand's preparations, he too had suffered an enormous amount of pain, and we'd both bled slightly. But we knew that we'd witnessed something that we couldn't explain. I think there were people there who did achieve a different state of mind and did it in a very different way. And I'm not sure I believe their God was helping them through it. But I know they did it and they didn't suffer and they did have a different state of mind. So how could they do this? I know how much this hurts, yet the devotees willingly inflict this on themselves and apparently do not feel the pain. Is it really a spiritual experience, or is there a more rational explanation? There is a group in India who claim you need no spiritual help to perform these piercings, and we'll see if their technique can work for us. But we're also going to the Himalayas, because beyond the reach of paracetamol and ibuprofen, the vast majority of the Earth's population have a much more day-to-day struggle with pain. Perhaps seeing how they deal with pain can help us to understand the extraordinary behaviour that we saw at Thaipusam. We're going to meet a Tibetan doctor, or Amchi, in the isolated Himalayan kingdom of Lo. He practices Tibetan medicine, an ancient system that has neither painkillers nor anaesthetics. Amchi Gyatso runs a medical school just a few miles from Nepal's border with Tibet, in the legendary city of Lomantang. But our first stop is the small mountain town of Jomsom. Jomsom is surrounded by some of the highest mountains in the world. We must spend 3 days here to acclimatise before climbing up to Lomantang. Since we're here, we go to see the local Tibetan doctor, an Amchi called Sampa Nawang. Our curiosity about what it's like for patients in a medical system with no painkillers is soon satisfied.
She's got an extremely crumbly back molar, which looks totally rotten. I hope this isn't going to involve a hot poker in anyone's mouth.
I think this is going to involve a hot poker in someone's mouth.
The spoon is covered with paste made from flour to protect her cheek from the searing hot poker. But she's been given nothing to help with the pain that's about to come her way.
There's quite a strong smell of burning tooth in the room now. This doesn't look very comfortable.
It takes a good minute and a half to burn out the infection.
That looks unbelievably painful.
I think that's a measure of how bad her toothache must be.
And yet, within a few minutes, the woman is smiling and talking happily. I may be wrong, but I imagine any patient in the UK would still be in agony. It's a graphic demonstration of what little regard the Amchi and his patients have for pain. In a surgery lined with medicinal herbs, Sampanawang gives us a checkup. His six-fingered pulse-taking shows him not only my heartbeat, but also how well everything from my sinuses to my lungs are functioning. Sampanawang seems to be saying that I'm suffering from a bit of altitude sickness, which is right. I feel lousy. There's nothing wrong with Xand, apart from a muscle pain in his shoulder.
Yeah, exactly. Yeah.
Xand gets some peach stone oil to rub into his shoulder, and the Amchi is going to prepare a herbal medicine that will help me to acclimatise.
Oh, it smells lovely.
And it tastes like eating sour dust. Ugh.
The people here are Buddhist, and although Tibetan medicine predates Buddhism, the two have become mixed. One of Tibetan medicine's most important ideas is that all illness, even physical illness, ultimately originates in the mind. As well as being an Amchi, Sampa Nawang is also a monk, and he explains that as part of his training, he spent a staggering 3 years living in isolation and meditating. As we climb toward a cave hidden in the side of a cliff, he explains that learning to control your mind through meditation is one of the most important skills a person can develop, and he's agreed to give us an introduction.
तर तपाईले अहिले वेस्टर्न इंग्ल्यान्डको डाक्टर भएको नाताले अब बिरामी उपचार गर्नलाई काम लाग्ने आफैको लागि काम लाग्ने एउटा म सिकाउँछु.
Following his instructions, we sit up straight, focus our gaze on the tip of our nose and try to relax. In the freezing cave, we sit silently for about 15 minutes. But it feels like hours. Thinking about nothing is much harder than I thought.
I don't know about you, but I had just a moment, maybe not even a minute, of not thinking about anything. I'd become very uncomfortable, my back ached, my knees ached, everything hurt. But I did have a moment of respite from that where I wasn't thinking about the discomfort or anything else at all.
I just can't get my head around doing it for three years.
You think it's a bit of a waste of time?
Xand, after his Malaysian ordeal, has had enough of spirituality. But my tiny moment of stillness is inspirational, and I'm going to continue to meditate in the hope that it will help me control my mind and handle pain more easily. The following morning, we begin our journey up to Lomantang and Amchi Gatso. It will take 5 days on foot, but we drive the first few kilometres with Sampa Nawang. To bring us good fortune on our journey, he's taking us to the temple of Muktanat.
I think if the car rolls, we die.
I can't wait to be walking. After 2 nerve-wracking hours, we finally reach Muktanat, a little village clinging to the side of a mountain. In the temple's courtyard, Sampa Nawang makes a strip and leads us to a line of gargoyles spouting icy water from the glaciers above. It appears this blessing ritual has a strong element of mind control to it. The idea is to run along beneath all 108 spouts. Sampa Nawang is unbothered by the icy water. I want to see if I can show as much control. The water is phenomenally cold. Xand follows me in. And Sampa Nawang goes round again.
I've got an ice cream headache. Oh, my head.
Sampa Nawang suggests the water might be good for Xand's shoulder.
Don't get... Is it getting better? You're getting used to it?
No! This is so much worse than my shoulder pain.
I'm not sure how this is any good for Xand's shoulder, but seeing how the Amchi deals with the cold is very impressive.
I was trying to put in practice a little bit of what I'm starting to get the hang of meditating, but it's just not a very good meditation environment.
After our good luck shower, Sampa Nawang goes back down to Jomsom. and Xand and I set off for Lomantang to meet Amchi Gatso. There are 5 high-altitude passes between us and our destination. We're already at an altitude of over 3,500 metres, and the lack of oxygen in the air is making every step more difficult.
Your oxygen saturation's of 90%. Your heart rate's 130, which would admit you to any hospital I was working in.
Xand's pulse oximeter measures our heart rate and how much oxygen is in the blood, and his figures are worse than mine.
What 90% means is your blood is carrying 10% less oxygen than normal. That might not sound like a big drop, but if you saw that in hospital, you'd be worried. And we feel it now. There's less oxygen getting to our brains. We're not thinking as well. There's less oxygen getting to our guts. We're not digesting food. We're losing weight. And you just feel tired and lethargic and unwell the whole time, don't you? It's like being ill. Yeah, it is being ill.
The breathtaking scenery and the treacherous paths take our mind off the altitude. And interestingly, since his icy shower, the pain in Xand's shoulder has disappeared. I'm still taking every opportunity to practice my meditation.
What an amazing place to sit and meditate for a while. I've normally got a very busy inner world. I think I've got a head full of thoughts the whole time. But the more I do this, the more I feel like I'm giving my brain a bit of a rest. And yeah, certainly even after a few minutes, I feel absolutely great at the end of that.
I don't know if it's the meditation or the herbal medicine I was given, but the lack of oxygen is affecting me a lot less than Xand.
I'm just really not enjoying being at altitude. I just feel sort of tired and lethargic and cold and a bit stuffed up. I've got a rubbish appetite. Yeah, it's like having flu, I suppose. I just feel rubbish.
3 days' walk from Lomantang, Amchi Gatso has left his medical school to come and guide us.
Very much. Well, that is a very fine welcome indeed.
That's really kind, thank you. It's really nice to see you.
He's one of the world's most respected doctors of Tibetan medicine. After 5 long days of walking, we get our first view of the city. Lomantang has been here for centuries, and despite its isolation, is a centre of great learning. Amchi Gatso has founded a medical school here. It teaches the traditional system of medicine, a system which has no painkillers. On our first morning, Amchi Gatso asks us for help, and we set up surgery on the roof of his medical school.
How about that? Is that all right?
He injured his finger in a threshing machine a week ago, and he wants us to look at it, because Tibetan medicine is not very good at dealing with infection.
Is the finger very painful at the moment?
I
think we need to remove this dead nail because underneath it is very dirty and it's at very high risk of getting infected if it isn't infected already.
It's a nasty job, but in order to clean up the wound properly, we're going to have to pull out the whole of the Amchi's fingernail.
Gatso, when you have severe pain, do you have a special way of using your mind to overcome pain? Do you meditate or anything like that?
मान्छेको सबभन्दा ठुलो मन हो मनमा के सोच्छ त्यो हुन्छ मनमा बेसरी दुखेको होला भनेर सोचे भने दुखेर आउँछ यता के दुख्दैन भने त्यति मनमा दुख्छ सबभन्दा ठुलो मन नै हो त्यसले मेडिसिन चाहिँ यो मेडिटेसन गर्ने एकदम जरुरी छ
We're here to learn how people cope without painkillers. But Xand will not consider removing his nail without local anaesthetic.
You just feel a sharp scratch just there. Well done.
As soon as the finger goes numb, Xand starts to remove the nail.
Doing this even makes me wince a bit. There we go. That's
The nail will grow back.
What I'd like is
Although removing the nail has allowed him to clean the wound, Xand is still extremely worried about infection, especially since he has a dusty roof for an operating theatre.
Doing things like this is a real reminder of how hard it is to practice medicine without a hospital around me, and how hard it is for someone like Gatso to do healthcare in this setting and be so confident about what he's doing. The only thing I'm really worried about now is infection, which somewhere like this is much more of a risk than in England.
We'll keep a close eye on Gatso's finger. The next few days will be critical.
You all right, Gatso? Yeah?
Later that morning, Gatso's back at work in his clinic. This man fell off his horse a week ago and has broken some of his ribs. Gatso is treating him by applying this paste onto the skin. It contains 17 different herbs, and he says it will make the bones heal more quickly. But Xand is very worried.
he could easily have a punctured lung and he may well have a chest infection. And the problem is that he's in a lot of pain. If he can't breathe properly and cough, he can't get the bugs out of his chest. And that makes him much more vulnerable to getting chest infections. In England, he'd get painkillers to allow him to breathe properly to stop him getting a chest infection. And he may well need antibiotics, and he's not going to get either of those things here.
But Gatso clearly isn't worried. He uses a bandage and a prayer scarf to hold the paste against the man's skin. And one of the students bags up some herbal tablets to help the man's breathing. Gatso has immense confidence in his herbal preparations, and I want to find out more about them. In one of the walled fields that surround the city, Gatso is cultivating a medicine garden, and he takes us to have a look.
If I had to ride to the bloody hospital pharmacy on a horse every time...
Tibetan medicine uses over 600 medicinal plants, some of which are unique to this area. Traditionally, they're collected from the wild, and Gatso is the first Himalayan Amchi to try and establish his own supply.
It's got a very big reach for a very small-looking plant.
Is this where the medicine is, Gatso?
औषधि चाहिँ नि यो झारा हो यो झारा मुनि 3 वर्ष राख्नुपर्छ यो अहिले 2 वर्ष भएको हुनाले त्यति ठुलो भएको छैन अनि यो यसरी काटेर यो टुचा चाहिँ नि अनि यहाँ रोप्ने हो यिनीहरू फेरि 2-3 महिनापछि 3 वर्षपछि फेरि यिनी जस्तै आउँछ हाम्रो आमची औषधिमा एउटा त धेरै काम गर्दैन कम्तीमा 3-7 वटा मिसाउनु पर्छ धेरैमा 100 जतिसम्म मिसाउनु पर्छ.
Perhaps being farmer, manufacturer and dispenser of all his own drugs is what gives Gatso his confidence. The following day, keen to see what the next generation of Amchi healers are like, we sit in on one of Gatso's lessons.
This is the heart.
And we compare notes with the students on our different theories of anatomy and the way the body works.
Blood goes through to the lungs. And what happens in the lungs?
It purifies.
You say that the blood is purified in the lungs.
Yeah.
Is that what you learn? Okay. So we think about it in a different way. We say that oxygen, air, comes into the lungs like this, and air gets attached to the blood.
A high blood pressure, we will see the urine is red.
I was very impressed with the students today. They were a really inquisitive, bright, multilingual group of people. And they knew a lot of science, and I'm just increasingly persuaded that although I don't necessarily understand their explanations about how Tibetan medicine works, I don't believe a group of people like that would be wasting their time on nonsense and mumbo-jumbo cures that didn't do anyone any good.
Lomantang is staggeringly beautiful, but very dirty. The only water supply is this filthy, icy stream running outside the city walls. It's used for washing and drinking by both people and animals. Today, we're going to check on Amchi Gatso's fingernail. Xand's extremely worried about infection.
Hey, oh, it looks wonderful. It's wonderful. I don't look as relieved as I feel. It looks brilliant. I'm really pleased. Now,
To keep the wound free of infection, Xand is going to clean it with iodine, which is horrifically painful.
and this is going to sting a little bit.
Is that painful? You squeeze.
Oh, I'm sorry.
Gatso told us that he didn't like the anaesthetic injection, and this time he doesn't want any pain relief.
Really clean.
People in England scream. I would scream. I think this is one of the most painful things you can do to someone. Can you make the pain disappear, or are you still feeling the pain and just not minding so much?
अहिले कम पनि दुख्छ यसमा सोध्यो भने अहिले दुखे पनि अलि सोचेर बस्ने हो त्यो यसमा घाउमा नसोचेपछि अलि कम दुख्छ दुखेर पनि अलि पनि सोच्नुपर्छ मनको कुरा हो.
So it helps to look at the mountains, look at the sky, yeah.
It's simple, but very effective.
Done. That's all I'm going to do, Gatso.
I'm practicing my meditating twice a day, but achieving Gatso's level of self-control is barely conceivable.
I think it's a form of mental discipline that I'm very unfamiliar with. I've spent a lot of my life doing things that you might think were required mental discipline, like reading books and getting degrees, but the discipline of having to empty your brain and not think of anything is actually it's extremely difficult, and it's not coming easily, and it's no wonder that people say it takes years and years to get it right.
It's our final day in Lomantang, and Gatso's paying a house call on the man with the broken ribs. To Xand's surprise, he looks much better and is obviously in less pain.
Good. Oh, it's nice to see you smiling. What I want to do is have a listen to your chest. Can I do that? If you sit forwards, and I'll just lift it up at the back. That's fine. Perfect. Some deep breaths, deep as you can. That's perfect. That all sounds excellent.
The man's chest sounds much better than Xand expected.
You're a miracle worker, Gatso. In England, I would have put him on big doses of painkillers, and he probably would have got some antibiotics as well. So you've managed to avoid all of that, which is jolly good.
The man is keen to tell us why he has so much faith in the Amchi's medicine.
तलमा चाहिँ नि अहिले हालैमा त छिटै उपचार भएर आउँछ पछि चाहिँ नि त्यो रोग चाहिँ अलि यसो उल्टाएर आएछ हजुर अलि लामो समय लाए पनि त्यो दबाईले चाहिँ नि पछिले चाहिँ नि त्यो थाहै नै हुँदो रहेछ हजुर.
You're doing brilliantly, which is...
I don't know if it's Gatso's treatment, but the man's ribs do seem to have healed remarkably quickly. And what feels like a calm and stoic acceptance of suffering, leavened maybe by the promise of reincarnation, has got him through some awful pain. In our search for the secret of controlling pain, it seems that we've swapped the frenzy of Thaipusam for the calm of Lomantang and still found the need for religious belief. But my attempts at meditation have had no religious dimension.
For me, meditation, rather than being a way of getting into some trance state or it being some cure-all, is an extension of that process of having command of your emotions and command of what's going in your head.
I kind of thought maybe you'd end up a rather different person as a result of it, and I don't think you have. Not yet.
So far, religion seems to be an essential part of dealing with pain. It's fascinating, but I'm struggling to make it work for me. The Federation of Indian Rationalists are a group of people who claim they can control pain without any religious belief at all. The rationalists are self-styled guru busters. They claim that fake holy men and gurus who go around performing apparently supernatural feats are conning money out of poor and uneducated Indians.
We are programmed from a very young age to believe without questioning.
We join the rationalists at one of their miracle exposure workshops. This one is for a group of nurses. They perform these so-called supernatural feats and give scientific explanations for them. Most importantly, they also put on spectacular demonstrations to get their message out to the public. These men are atheists. They insist that they do not feel any pain during these piercings and that this has nothing to do with religion or being in a trance. I'm not sure I believe this, and I take a closer look for any signs of pain or distress.
I'm just taking his pulse to see if he's nervous. His pulse is lower than mine. His pulse is about 60. This is not a man who's afraid, sweating, worried.
Yeah, what do you want to ask?
There won't be any pain.
Just like at the festival of Thaipusam, a huge metal skewer is pushed through the man's cheek.
I still think that's really, really difficult to watch.
Yeah.
That's a bigger spike than we did, and I think he looks like he's in considerably less pain than we were. Can we take his pulse again?
That is amazing. And you're not in a trance, you can hear me?
No, already no pain.
Yeah, I mean, this is a man who's conscious, awake, feeling fine, and his pulse hasn't changed a bit.
As doctors, we've seen patients cope with all kinds of pain, but neither of us have ever seen anything like this.
I'm really, really, really blown away. That is...
It gets even more extraordinary. The finale of their guru-busting act is a sensationally gruesome stunt. They'll suspend themselves from hooks through the skin on their backs on a kind of masochist's merry-go-round. The skin on your back is not the most sensitive area on your body, but this must be excruciating.
You all right? Any pain? You're okay? How long could you do it for?
1 hour, 1 hour. 1 hour, 1 hour, 2 hour, vehicle. This skin nothing happened. Skin nothing happened. Vehicle.
The two men are released, but Xand and I cannot understand how they were able to overcome the pain. They seemed so cheerful.
You've done it many times before?
Oh, anytime, many times.
The following morning, Xand and I head to a village, 3 hours' drive from Mangalore. The rationalists are putting on a demonstration for the local villagers, and we're going to take part as well.
I think I want to see if I've actually learned or genuinely discovered anything from yesterday, and if I can do the trick of having something big put in me and pretend like I don't care.
Is that what you think is going on, that they're just pretending they don't mind?
I don't think they're pretending they don't mind, I think they're genuinely not minding.
It sounds so simple, but will I be able to do it? We're soon at work, helping to assemble the rationalists' merry-go-round.
It feels a bit like building your own gallows or digging your own grave, doesn't it?
Yeah, that works quite well. Yeah, it's quite good, eh? It's all right.
Even a quick swing is enough to let us know what it would be like to hang from it.
That's the amount of weight that's going to be going through the hooks. And I really am quite convinced now that I don't really want to do it.
I don't think I can do it either. Just helping the men as they prepare to suspend themselves is making me feel sick. The men are soon going through their suspension routine. It looks excruciating, yet they're still smiling. Is that really all it takes to make the pain go away?
That's right, shut off.
Curiosity is getting the better of me, so I ask them to put a hook in my back and see how far I can take it from there.
So I'll just ask you a few questions while it's going on. Just tell me your name.
My name's Chris.
Right, what do you do for a living?
I'm a doctor.
Just tell me a bit about what you do as a doctor.
I really want to see if I can get rid of the pain, simply by acting like a man that isn't in pain.
And where do you work?
I work in London. At the hospital.
Xand monitors my attempt.
How are you doing now? You all right?
He checks my pulse, and it's staying normal, but my mind is racing.
Yeah, I don't know quite what's going on, so I'm a bit anxious. It's quite a brutal thing. Like,
And you're going to have two or just the one?
I think I'm just going to have one.
Right, okay.
Because it's certainly not painless.
Xand ups the ante by seeing if I can tolerate having even a little weight put on the hook.
Does that hurt?
I think I'm really...
Can I give it a good pull?
No, don't give it a good pull. Just everyone step away from me. Don't wiggle it.
I can't see what's happening, and I'm starting to panic.
Everything's tense, like I've really...
But something suddenly clicks.
And just don't react. If I just pull a bit more, just don't react. Just pulling a bit more. Like, just tell me it doesn't hurt.
Yeah, it doesn't hurt, it's fine.
Does it hurt at all?
No, not a
Must
bit.
hurt a bit.
Nope.
It must be quite painful.
No, honestly, it feels quite good, actually. It feels nice. It's like a back rub.
It's like having a back scratch.
It's like, I tell you what, I had a real itch there. To the lower. 1, 2, 3.
My technique is actually working. Although the pain isn't going away, I really am not that bothered by it anymore. I'm happy to keep this up for a few more minutes before the hook is taken out.
Are you still pulling it slightly?
Yeah.
Okay, you're going to observe me?
Yeah. Oh, yeah, it can come out now. All right, it's just...
I think the key thing is just to totally relax your body. Is it out?
Done?
We done?
Before I even realise, the hook is out.
Thank you very much. You did that really nicely.
Despite all my fears beforehand, the experience has taught me something new and important.
What I learned over the course of doing it was not how to diminish pain, but how to not mind pain. And taking it out hurt every bit as much, if not more, than putting it in. It just didn't bother me.
Our journey through Asia has been extraordinary. We wanted to learn how the mind can control pain, and I think we've found some answers. Nobody has shown us a way to stop feeling pain.
This is going to sting a little bit.
It's all about learning to control your reaction to it.
Well done.
And as I've discovered, that is definitely something that can be taught.
I think if I just go, it doesn't hurt a bit, I'm absolutely fine.
It may seem that the devotees at Thaipusam are worlds apart from the rationalists of Mangalore, but I believe that in both cases it's faith and motivation that are central to overcoming pain with the mind.